First, live, local. This is WEAR 3 in the morning. Now in high definition.
All right, Christian, thank you very much. Welcome back to 3 in the morning. Of course, in the next few minutes, we're going to talk about surgery and postoperative pain. Some anecdotal and clinical research shows that the fear of experiencing pain after surgery may lead some patients to postpone or even decide not to have a procedure. However, in recent times, there have been great advances in pain control. One of the people on the leading edge of treatment of acute pain is Dr. Gregory Hickman from the Andrews Institute in Gulf Breeze, who joins us this morning to talk about pain after surgery. It can hurt. That's for sure for a lot of people. Let's talk about that in a minute. I want to start our conversation talking about you, your background, and what has brought you to the Andrews Institute.
Thank you, Jared. It's good to be here. The Andrews Institute, I've been working with Dr. Andrews in Birmingham since 1992. And so we've worked together for a long time. I'm the anesthesiologist, been taking care of his patients and treating his patients' pain for many years. And he invited me down here to help open up the Institute, and I was very happy to get that opportunity and have enjoyed it, and we've done a lot of work here.
And you have a great interest in relieving postoperative pain in a newfangled kind of way.
Yes, absolutely. We have a new pump that allows, we've been doing nerve blocks for shoulder surgery, knee surgery, that just numbs up the certain part of the body that's having the surgery, the pain. And that way we can avoid narcotics that cause a lot of terrible side effects like nausea and vomiting and confusion. And this just numbs up that area, but this pump allows us to extend the duration of the numbing for about 3 days.
Is that generally the term of time where post-surgery it really kind of hurts?
Depends on the type of surgery, but oftentimes it is, yes. If you can get through that first 2 or 3 days, it really gets you over the hump to where you can do well.
You know, it seems like a pretty simple idea. Why didn't anyone think of this a while back?
It's a great question. It's very simple. The patient, this is hooked up to them before they leave the facility, and it just runs on its own. You don't have to do anything. You don't have to push any buttons. You just turn it on, let it run, and it just goes.
Now, it's not a narcotic?
No, not a narcotic. It's just numbing medicine, like you went to the dentist and got your tooth numbed.
And it will last for how long?
Usually about 3 days, 3 to 4 days, depending on the rate it's running at.
I think some people are familiar with, I think sometimes in the hospital you have a little button you can push for your own, if you need some pain medicine kind of thing. Correct. This thing operates entirely on its own.
Correct.
You don't have to do a thing.
No buttons, right. And no narcotics.
And you just carry it around in a bag?
Right. You just put this around your waist, around your shoulder, carry a little on-cue bag, and then when it's done, you just pull out the little catheter that's going into delivering the medicine.
Is this becoming more common in other surgery beyond orthopedics?
Yes, different types of surgery. You mentioned hernia surgery.
I had a hernia surgery a few months ago, and it hurt shockingly painful, I thought, the next day. And I sure could have used one of these deals. So it's becoming more common, or will be?
Yes, more and more common. It's growing. It's fairly new. This has been around for a couple of years. This pump here, they've had other pumps that have been around a little bit longer, but it's continuing to grow and become more popular.
And it has, I think, it seems to have all the advantages and none of the disadvantages of your traditional narcotics.
Absolutely, absolutely.
If people are facing surgery, orthopedic or otherwise, are a little curious about this, where would they find out maybe some more information?
They could contact the Andrews Institute website or give us a call at the Institute. They could go to the OnCue website. And we'll be glad to answer any questions. It's not available for every surgery, obviously, but many, many times it can be helpful.
Well, Dr. Hickman, next time I face surgery, which I hope is never, I'll be giving you a call. Thank you very much.
Absolutely. Thank you, Jim.
All right. Taking a break on 3 in the morning. We'll be right back with your answer to trivia and a look at today's history in Pensacola.